3, 2, 1.
Just imagine working in a dentist's office on a busy day. Some patients will seem fine, others may seem anxious, and maybe even crying. Some patients may not fully understand the procedure that will be done. The only way to fix these problems is by effectively communicating with the dental patients. Today I will be talking to you about how to effectively communicate with them. I realize that you all might not be going into the dental field, but some of the basic concepts that I'm going to talk about can be used in day-to-day communication. I've thoroughly researched this topic and have also practiced the concepts in my dental assisting class with my student partner. Today I'll be talking about greeting and using confirmation with the dental patient, active listening and feedback, and dealing with the anxious dental patient. I'll begin by talking about greeting and using confirmation with the dental patient. On the Dentistry IQ website, I found an article from July 2011. The article is titled, How to Increase Communication in 8 Areas of the Dental Office. It is written by Hayley, an instructor and treatment coordinator at the Nash Dental Institute. In this article, she talks about using confirmation and making sure the patient knows exactly what the appointment is about and what is going to be done. This must be explained to the patient in simple yet informative terms. Also, the greeting is discussed in this article. The patient should be greeted with a welcoming smile. It is also effective to ask patients questions about how they have been since their last visit. This can help keep the patient's mind off of the procedure. Next, I'm going to talk about active listening and feedback. I found another article on the Dentistry IQ website from January 2013. It is titled, Tips to Enhance the Effective Communication Skills for the Dental Assistant. It is written by Carolyn Breen, the 2012 to 2013 president of the American Dental Association. It states that it is important to listen to others and show them that you are listening. After active listening occurs, feedback must be given to the patient. A great way to provide feedback is paraphrasing what the patient has said. Patients have a feeling of ease when they know they are actually being listened to and being taken seriously. Also, active listening and feedback are a great way to show the patient respect. Finally, I will talk about the anxious dental patient. On the Oral Health Care Group website, I found an article from February 2012, Practical Considerations for Treating the Anxious Dental Patient, written by Dr. Robert McMaster, a resident physician, and Dr. Garisto, an assistant professor in the discipline of anesthesia at the Faculty of Dentistry. The article talks about recognizing the anxiety of the patient by asking the question, last time you visited your dentist, how did it go? A response like, I was totally fine and relaxed during the treatment would get a rating of 1 on the dental anxiety scale and show no anxiousness. A response stating, I was nervous but the treatment went successfully would get a rating of 2, which means they were slightly frightened. A response like, I was so nervous the treatment was barely finished would get a rating of 3, meaning they were moderately frightened. Responses varying from, I was so frightened and nervous that treatment was difficult, I was so frightened and nervous that treatment did not succeed, or I was so frightened and nervous that I had missed my appointment, would earn a ranking of 4, meaning a severely frightened patient. The responses that come from these questions can help guide patients' treatment. Obviously, patients ranking 3 or 4 need a high amount of assurance from the dentist and assistant, and maybe even will need to take breaks during the procedure. A patient that ranks 2 would just need moderate assurance. Patients ranking a 1 would handle dental procedures just fine, but they would still need slight reassurance just to be safe. The main pointer to use on the anxious dental patient is to use a calm and reassuring voice. This will help the patient feel at ease. This evening I've talked to you all about greeting and using confirmation with the dental patient, active listening and feedback, and recognizing anxiety in the dental patient. I hope that you have all learned something when it comes to communicating in general. I know you all aren't going into the dental field, but the concept of active listening and feedback is something you can always apply to your everyday communication skills. Thank you for your time.